Welcome to Bariatric Business Accelerator, the podcast created for busy weight loss practitioners and their teams who want to systematize, simplify, and accelerate the growth of their new or established weight loss practice. I'm your host, Carol Clark, and today I wanted to talk a bit about proper treatment truly comes from proper diagnosis in your weight loss practice. And so what I mean by that is that if you're experiencing problems in your practice, no matter what they are, it does require diagnosis as the first step before there's going to be any sort of resolution or anything like that. We can't hope our problems away. And if you know something's going on in your practice, you need to trust your gut and we need to address that head on. So treating the symptoms is not going to be effective, as you know. It's just like with your weight loss patients, treating some of the symptoms or just helping them put a patch on some of their underlying problems really doesn't result in long-term weight loss. It may result in short-term weight loss, just like you can put out fires a long time. It's exhausting, but you can put out fires for a long time. But if you don't get to the root cause of the problem, it will eventually explode at some point or regress to a point where it's just unbearable for so many people. So we need to do a proper diagnosis. So you as a clinician are very good at differential diagnosis. You're used to doing this every single day. We can't treat chest pain. We need to decide, is it heartburn or is it truly a cardiac issue? So for this too, in your practice, if there's something going on, we need to figure out the root cause. So what are some of the most common things that we see? And if you are experiencing these, you are not alone. Some of it relates to inefficient operations. So perhaps your scheduling is awry. You end up with patients bunched at one time of the day. You end up with you're behind all the time. Your schedule just doesn't reflect what it's supposed to. That could be one sort of an issue. It could be workflow. It could be just a communication breakdown. So inefficient operations is a very frustrating one. When those are fixed, it makes everyone's life a lot easier. So another issue you may be having is poor lead conversion. Maybe you have a lot of leads coming in, people that are expressing that they're interested in what you offer, but yet your schedule's not full. You're just not seeing the consults that you should. So what is the underlying reason for why that is happening? The other one is you may be experiencing high team turnover. So if you have a lot of that going on, we need to take a look at what is some of the underlying conflict that might be causing that, or what is it that is creating people to start with your practice and then leave quickly, or to have people leaving sort of sometimes in practices a mass exodus, or a lot of people leaving at the same time. So like I said, we can't hope our problems away. If you're having an issue, we need to address those head on. So it involves you as a leader having open communication involving your leadership team. And oftentimes, if depending on what it is, you may need to get some input from a lot of people on your team. Everybody has a different side to a story. So no matter what it is, we need to address it in that way. So we take a look at the problem and we ask, why is that occurring? And then you ask why again and why again. So if the problem is that you're having a high degree of turnover, we ask, why is there a lot of turnover? So then you may find out that people are leaving because of some sort of interpersonal conflict, or they just never felt welcome, or they didn't know what their role was. So then we need to get into why didn't they understand that? Why was there that conflict? Why didn't they understand what their role is? And then we may find out that perhaps the onboarding process isn't very smooth, or we've got somebody who is sort of an informal leader and maybe creates cliques and a lot of interpersonal drama in the office. So then if that's happening, why is that happening? So we ask why a number of times so we get to really the root cause of that, and then we determine how we're going to deal with that. And it doesn't take, unfortunately, I wish it was just like a one-time thing. You may end up terminating a particular employee, which does improve things, but oftentimes there's other things that are going on. So we need to ask all those questions, and then we need to sit down and determine what's our plan moving forward. Determine what plan you're going to do moving forward in terms of a new system in place for scheduling, a new way for you to follow up with your leads, a new marketing tactic, making sure that you maybe instead of something new, you just need to refine what it is that you have in place because it's working pretty good, but it's just not working well enough. So we need to take a look at that. You might have all the right people in place, but perhaps they're in some of the wrong positions. So we need to take a look at all that, determine a plan moving forward, implement that plan. And isn't like, a one-time thing. It requires constant attention to make sure that there's follow-up, accountability, and that you're getting to that root of that problem, that you're causing a fix in there. You're creating a positive outcome from what your actions are. If not, then we have to regroup and start over again. I know this is not rocket science, but it's one of those things that oftentimes gets put on the back burner in any practice because we're putting out fires all day long. We're so busy. And yet, if we just fixed a couple of the basic things, that it does take time, I know, but if we fix some of those operations or communication or where team members are in your organizational chart, or how clear their roles and responsibilities are, or are you looking at the financials? Is there a product line that you have or a service line that you have that's not profitable? It's bringing everything else down. All these little underlying causes need to be reviewed. So anyhow, at the end of the day, we put that into place, we reevaluate, and then with the metrics, and then you keep working at it until you have something that's working a lot better and that problem has dissipated. You will thank yourself once you address this head on. When we ignore things, they tend to just get bigger and bigger and bigger. So I encourage you to do that. Make sure that you do proper treatment through proper diagnosis, just like you do with your patients. So anyhow, I see this all the time, and I wanted to share that just to make sure people are, addressing that. And if I can help in any way, please reach out to me. If you haven't subscribed to the podcast, please do right here, wherever you're listening. And you can always reach me at weightlosspracticebuilder.com. Plenty of ways to reach out to me there, or my email, Carol, Karol, at weightlosspracticebuilder.com. Thanks so much.